Throughout this chapter, we've examined disorders of anxiety, mood, trauma, and reality. Let's complete the picture with one more category and then close out our entire journey through psychology. The personality disorders are enduring, inflexible patterns of inner experience and behavior that deviate markedly from cultural expectations, cause distress or impairment, and remain stable over time. Unlike a disorder that descends and then lifts, these patterns are woven into the fabric of how a person characteristically relates to the world. Consider two examples. Antisocial personality disorder involves a long-standing disregard for the rights of others, deceit, impulsivity, a lack of remorse, and a failure to conform to social norms. Borderline personality disorder involves pervasive instability in emotions, in self-image, and in relationships, along with intense fears of abandonment and difficulty regulating powerful feelings. These conditions are challenging, but contrary to old assumptions, they can improve with appropriate treatment, particularly specialized forms of therapy. And that points to the hopeful thread running beneath this entire chapter. Every disorder we've discussed is, to varying degrees, treatable. Anxiety disorders respond well to therapy. Depression can be addressed through therapy, medication, or both. Even severe conditions can be managed so that people live full, meaningful lives. The single most important message is this: if you or someone you know is struggling, help works, and seeking it is an act of strength, not weakness. Now let's step all the way back. We began this course with a simple definition. Psychology is the scientific study of mind and behavior, and a single stubborn habit, asking, is that actually true? From there, we traveled an enormous distance. We went down to the single neuron and up to the whole society. We saw how we sense and perceive, how we learn and remember, how we think and speak. We watched a human being develop from a single cell and explored what drives us, what moves us emotionally, and what makes each of us a distinct personality. We saw how powerfully other people shape us, how stress writes itself into the body, and finally how the mind can falter and recover. If one theme has run through all of it, it's this: human beings are at once biological, psychological, and social creatures, and we're far more complex, more surprising, and more changeable than common sense alone would ever guess. The goal of this course was never to make you memorize a list of terms. It was to give you a new set of lenses for understanding yourself and the people around you with more curiosity, more rigor, and more compassion. That understanding doesn't end when the course does. It's a lens you'll carry for the rest of your life. Thank you for taking this journey through the science of the mind. Keep asking the question that started it all: is that actually true? And keep looking closely at the remarkable, complicated business of being human.